I want to ask the Minister the number of drug support workers in County Tipperary and the support available for young people in County Tipperary, and what actions indeed you're taking along with Garda Síochána to deal with the growing drug and mental health problems which are intrinsically linked, working with the Garda Síochána in Clonmel and indeed all over Tipperary.
Thanks, Deputy McGrath, for raising this issue. I have been to Clonmel and Tipperary and seen the great work that the services have done. And the National Drug Treatment data shows that 380 cases were treated for problem drug use in Tipperary in 2021. Of these, 114 cases were treated for cocaine as the main problem, and separately there were 294 cases treated for problem alcohol use. Drug services in Tipperary are provided by the HSE, the Regional Drugs and Alcohol Task Forces and Section 39 funded community and voluntary groups. I am providing a comprehensive report on these services for you, Deputy. The Government's health-led approach to drug and alcohol use is set out by the National Drug Strategy, Reducing Harm and Supporting Recovery, and my priorities for this strategy are to strengthen prevention of drug and alcohol use and associated harms amongst children and young people, and to enhance access to and delivery of drug and alcohol services in the community. In Budget 2023, I secured €4 million in new development funding to expand the provision of drug and alcohol services to meet changing patterns of drug use and emerging trends. And this investment will expand community-based drug and alcohol services, ensure sustainability and increase the capacity of residential treatment services, mitigate the impact of drugs on children, families and communities, and strengthen drug monitoring and harm reduction. Full details are set out in the budget fact sheet, and I am committed to a health-led approach to drug use that promotes a compassionate and humane approach to people who use drugs, with addiction treated first and foremost as a public health issue.
Thank you, Minister. Minister, every town and city in the country has been plagued with drugs but the last 18 months, the town of Clonmel and Tipperary, my own town, a fine town, the drug crisis has gotten almost out of control. It's so sad, and we have no mental health support. We don't have one long-stay bed. Crack cocaine and heroin are now openly available in the main street and cutlery in the main street, and unfortunate souls are seen begging, falling over, out of their minds, are being physically or verbally abused, or fighting amongst themselves. And it's destroying themselves, but it's also intimidating shoppers, and therefore has a huge knock-on effect on the business of the town as well. And it's so sad for those who do manage to make their way through rehab. There are the huge risk of falling back into the use of drugs because, as I said, there's such an availability, and they're everywhere. And nightclubs and every place else, it's very alarming, and I don't think we've enough of support workers. At the JPC meeting last week, the Chief Superintendent said he wanted to see more drug support workers working in liaison with Garda Síochána, because it needs to have an all-hands-on-deck approach here and support from different sectors of society.
A lot of very good and necessary work is being done. I want to thank all the stakeholders, the Drug and Alcohol Task Forces and everybody providing a service in this very difficult situation. But, as I said, we secured €7 million for new developments, and €1 million was to strengthen monitoring of emerging drug trends and to expand community-based services as part of Community Services Enhancement Funds. In relation, I recently announced an allocation of €1.5 million for a 3-year drug prevention and education programme. This is the first time that national funding has been made available for drug prevention. And this programme is a key deliverable under the National Drug Strategy to strengthen the prevention of drug and alcohol use and related harm amongst children and young people. And, there is a lot of good work being done regarding schools, family, the general community, and I just want to thank again all the stakeholders for the really great work that they're doing to prevent drug use as much as possible.
I accept there's good work being done, of course there is, up and down the country, but we just don't have the resources. We have to try and break the cycle, because it's sad when more and more young people, fall back into it after going through rehab, as I said. The housing crisis and drugs crisis are inextricably linked, and that's a well-known factor, accepted by all people who review this area. As I said, we have to break the cycle. And we have to try and impact. Schools are doing their best, certainly yes, but after school then, people seem after 18 or 17 to be at the mercy of the waves, really, and it's a huge problem. And I wish I could stand up and talk about something more pleasant here this morning, but it's an appalling situation, as I said, in Clonmala. And as I said, fine town, fine people, second biggest inland town in the country, but we don't have the resources. The Gardaí have the resources, but they can't do it alone. They need the support workers, and they need to be active and visible and seen and try and deal with this problem, to get it off the streets, but above all to get these people out of the drug-taking habits, and indeed to get them back into rehab and try and get their lives back on track again. Because it's so sad to see unfortunate souls, as I said, around the street that don't know where they are or what they're doing, and falling, as I said, and indeed intimidation, and it's desperate. They're all human beings. And we need to look after them and try and mind them and have them in some modicum of safety, as well as the other people who share the street space with them.
The government's health-led approach to drug and alcohol use is set out in the National Drug Strategy, reducing harm, supporting recovery, and my priorities in the strategy are to strengthen the prevention of drug and alcohol use and associated harms amongst children and young people, and to enhance access to and delivery of drug and alcohol services in the community. You've raised a very an issue that is impacting on lots of cities, towns and villages around the country. And what we have to do is to strengthen the drug monitoring and the harm reductions, and also mitigate the impact of drugs on children, families and the communities. And again, I want to thank all the various stakeholders from across many departments, and Section 39 workers and many voluntary workers for the incredible work. And you're absolutely right. There has to be a compassion to people who use drugs, and there have to be a way forward. And again, I'm just blown away by the great work that's been done by all these communities.